Artificial Intelligence Dr. www.abcpharma.net/English. User question. How does the pacing site of a unicameral leadless pacemaker influence QRS duration and overall ventricular activation patterns in patients with LBBB? GPT-4o answer. The pacing site of a unicameral leadless pacemaker significantly influences QRS duration and overall ventricular activation patterns in patients with left bundle branch block, LBBB. Here's a detailed exploration of how the pacing site affects these factors. Influence of pacing site on QRS duration and ventricular activation. Right ventricular apex, RVA. 1. Activation pattern. Pacing from the right ventricular apex typically results in a broad, LBBB-like QRS complex because the activation sequence mimics natural conduction delay in LBBB. 2. QRS duration. In patients with pre-existing LBBB, pacing from the RVA may not significantly shorten the QRS duration since the electrical impulse follows a similar delayed pathway. 3. Hemodynamic effects. RVA pacing can result in less efficient ventricular contraction and potentially worsen dysynchrony. Right ventricular septum. 1. Activation pattern. Pacing from the septum may provide a more physiological pattern of activation compared to RVA pacing. 1. It can lead to a more synchronized contraction of the ventricles. 2. QRS duration. Septal pacing might result in a narrower QRS complex compared to RVA pacing but may still not significantly alter the QRS duration in patients with LBBB. 3. Hemodynamic effects. This site can improve mechanical synchrony and overall cardiac efficiency compared to RVA pacing. His bundle pacing. 1. Activation pattern. Pacing the His bundle can directly stimulate the natural conduction system, bypassing the block in the left bundle branch. 1. This can lead to a near-normal activation pattern of the ventricles. 2. QRS duration. His bundle pacing can significantly narrow the QRS complex, even in patients with LBBB, by ensuring a more physiological ventricular activation. 3. Hemodynamic effects. This method can restore synchrony and improve cardiac output, reducing symptoms of heart failure. Left ventricular sites, biventricular pacing. 1. Activation pattern. Although not applicable to unicameral leadless pacemakers, biventricular pacing involves stimulating both ventricles simultaneously, improving synchronization. 2. QRS duration. This can significantly narrow the QRS complex and improve overall ventricular function in patients with LBBB. 3. Hemodynamic effects. It enhances mechanical synchrony and is particularly beneficial in patients with heart failure and LBBB. Mechanisms of influence. Electrical propagation pathways. 1. Site-specific activation. The site of pacing determines the initial point of depolarization and the pathway the electrical impulse follows. 1. More central or septal locations can promote faster and more coordinated depolarization. 2. Block bypass. His bundle pacing can bypass the site of the block in LBBB, promoting more natural and efficient ventricular activation. Mechanical synchrony. 1. Synchronous contraction. Optimal pacing sites can improve the coordination of ventricular contractions, reducing mechanical dysynchrony. 2. Hemodynamic improvement. Better synchronization leads to improved cardiac output and reduced symptoms related to heart failure. Adaptation over time. 1. Remodeling effects. Chronic pacing from suboptimal sites can lead to adverse remodeling and worsened dysynchrony, while optimal sites can promote beneficial remodeling. Evaluation and optimization. Electrocardiographic monitoring. 1. QRS analysis. Continuous monitoring of QRS duration and morphology helps assess the effectiveness of the pacing site. 2. Pattern recognition. Identifying changes in QRS patterns can guide adjustments in pacemaker settings or lead placement. Imaging techniques. 1. Echocardiography. Assesses the mechanical synchrony and ventricular function post-implantation. 2. Cardiac MRI, CORT. provides detailed anatomical and functional information to optimize pacemaker positioning. Electrophysiological studies. 1. Mapping. Invasive mapping can identify the optimal pacing site for achieving the narrowest QRS duration and best mechanical synchrony. Summary. The pacing site of a unicameral leadless pacemaker significantly influences QRS duration and ventricular activation patterns in patients with LBBB. Optimal sites, such as the right ventricular septum or his bundle, can improve electrical and mechanical synchrony, leading to better clinical outcomes. Continuous monitoring and advanced diagnostic techniques are essential for evaluating and optimizing pacemaker placement in these patients.